today. He's going to be guiding us through the session. Namaste, welcome, Amipara ji.
Namaste to all and very good afternoon. I am Dr. Amipara on behalf of Organizing Committee ICH VHE 2025. I warmly welcome all dignitaries, moderator, UHU point of view, panelists, and all other delegates. Yesterday, we have discussed about the need of holistic human health, and also we have heard during our keynote address also, and what is the importance of the holistic human health. Today, let us move further one step. Let us have an expert views on a vision or on a holistic human health. It is my privilege to introduce today's moderator and UHU point of view, Dr. Sharmila Asthana, madam. Dr. Sharmila Asthana did her MBBS from Mahatma Gandhi Memorial Medical College, Indore, pediatrics from Regional Children's Hospital, USA. Madam has worked as assistant professor of pediatrics at St. Christopher Hospital for Children, USA. Madam served as a senior consultant pediatrician with the Apollo Hospital for about 17 years. Also worked with lipid diagnostic. Madam has keen interest in ambulatory pediatrics education, children for a minimum use of medication. Since 2018, Madam has left the practice and devoting full time to UHV and pursuing approach to health. Madam is a resource person to UHV workshop as well as human health workshop or program. She has co-authored book on holistic human health. She lives in Hyderabad with her family. Her interest is reading and writing the books. With this brief introduction, let me once again welcome Dr. Sharmila Asthana. Over to you, madam.
Thank you very much for your kind introduction, Dr. Amipara. Moving ahead, I would like to officially welcome all our esteemed panelists for today. And I will briefly introduce everyone, just give a brief introduction of all the panelists. And followed by that, I will just describe the process that we are going to go through with the panel discussion before we just get into the crux of it. So we have with us Dr. P. Kala. She is professor and head pharmacology, PSP Medical College Hospital and Research Center in Chennai. She has a rich 25 plus years of clinical teaching and research experience in the medical field with more than 20 publications to her credit. She has a keen interest in holistic health education. Welcome, Dr. Kala. Nice to see you again today. We have Dr. Meenakshi Manrekar. She has a bachelor's in Ayurveda and is a postgraduate in Ras Shastra and Bhaishya Kalpana. I hope I'm saying that correctly. That is Ayurvedic pharmacy. With more than 20 years of professional experience in clinical research and academic areas, she is now pursuing a PhD from Datta Mege Institute of Higher Education and Research in Wardha, Maharashtra. So welcome, Dr. Meenakshi. Good to have you with us today.
Thank you very much.
We have sitting next to me Professor Dr. V. Satyanarayanan, Associate Dean, Student Affairs and Professor of Pharmacology in SRM Medical College Hospital and Research Center. He has 31 years of teaching experience, 25 years of clinical and 15 years of research experience with several awards and publications to his credit. He also has a very keen interest in human values and holistic health education. Welcome, Dr. Satyanarayanan. Nice to have you with us again today. We also have today Dr. Sudipta Ghoshal, who is a clinically practicing homeopath with also having nearly 25 years experience in hospital administration, medical affairs, and healthcare services. He is head Department of Hospital Management in Paramedical College in Durgapur. Welcome, Dr. Sudipta. Nice to see you again today.
Yeah, thank you.
Ji.
Welcome.
We have sitting next to Dr. Satyanarayanan, our budding medico, Ms. Kriti Sharma. She is a second year MBBS student at SRM Medical College and Research Center. She is passionate about clinical medicine, research, and about bridging the gap between holistic healthcare and current medical practices, and eager to explore new ideas and opportunities in this field. So, welcome, and we look forward to hearing more from you today, more insights. We have Dr. Manoj Kumar Sharma, who is an educator and an administrator working as the principal at Veena Memorial College of Education, Karoli, Rajasthan. He has a doctorate degree in education from University of Rajasthan, Jaipur, and has published some 28 research papers on national and international research journals, and made significant contributions in the field of educational teaching, research, and administration. Welcome back, Dr. Manoj Sharma. Then we have Ms. Teresa Su, who is joining us today all the way from Hong Kong. Welcome. She is, besides being a former award-winning broadcast journalist, Ms. Teresa is also a university lecturer, international wellness speaker, mental health advocate, and lifestyle educator. She has been inspiring students of all ages to manage their stress and emotions through simple holistic practices such as breathwork, yoga, tai chi, lifestyle, nutrition, and grounding exercises. And she has been empowering students to be life ready. Welcome, Ms. Teresa. Very nice to have you here. Namaste. And we also have Dr. Swaroop Kumar Panda, who is an accomplished medical biochemist with an MBBS and an MD in biochemistry from the Institute of Medical Sciences, SUM Hospital, Bhubaneswar, which comes under Siksha O Anusandhan or SOA deemed university. So welcome back, Dr. Swaroop Panda. Nice to have you with us again. Now that we've been through brief introductions of everybody, I would like to just mention briefly the process that we are going to go through in this panel discussion. So what we'll be doing is that I will start with just giving a brief overview of a proposal of a vision for holistic health. And then with that, once we have put that before you, we will take your views on holistic health, and some of the questions that will be put before you will be regarding whatever we talk about in the session. All of you as panelists will be given 3 minutes to put forward your views, your thoughts on it. Please be mindful of the time. On the right-hand side of your screen, upper part of the screen, you will notice a stop clock that starts when you start speaking. And that will give you an idea of the time. So please be mindful and try to finish your thoughts on the topic in about 3 minutes so that we can cover more ground in the session. As we said before, we request for all panelists to keep their videos on throughout so that they can be seen. I also want to welcome all the delegates who are watching. We may not be interacting with you verbally here, but I just want to mention that while listening, you may notice a small a poll that may come up on your screen. And if you see that, please do answer it. That will be our way of interacting with you. And we look forward to your views on the questions too. Later, after the round of panel discussion is over, which will be for about 45 minutes, maybe with moderated 2 or 3 rounds, probably just 2 rounds of questions. After that, we will open the floor for questions from the delegates. And for about 10 minutes, we will be doing that, taking questions from delegates and from the chat and discussing those questions. So this is how we are going to move forward today. So all the very best to everyone. Looking forward to all your views. And we can move forward now to the view on holistic health that we wanted to talk about. So this is day 2 of the conference. And here we are going to talk about our vision for empowering youth to take charge of their health holistically. If we look at what we talked about yesterday, we did a brief SWOT analysis of the current state of health of youth and of the health system. And we mentioned that there are many strengths that have been, that we could see in the current health system, like antibiotics, vaccinations, trauma care, and all of that. But at the same time, there are several weaknesses also. For instance, a lack of a holistic approach. When we talk of physical health, we largely seem to be disease-centric. We often work on bringing down symptoms, managing diseases for life, rather than curing them from the root. And where mental health is concerned, we are often treating with medicines that are given to the body, maybe not very clear about the root cause. When it comes to values and ethics, profit maximization seems to have become the mantra of today's health system. And with that, health has become unaffordable. Today, it is overly expensive and out of the reach of many, making the health system pretty much unsustainable in its current form. We also discussed about other possibilities, perhaps a shift in perspective, perhaps a holistic approach, which we are going to talk about, get right into it as of now. Yes, so if we look at this, what you see before you on the left side of the screen would be a disease-centric approach that we seem to be taking today. So if you look at physical health, we are largely trying to get rid of disease. So we use medicine, treatment, and in the name of problem solving, we are often suppressing the symptom. Is this adequate? So obviously this is not sufficient, and we propose a shift in paradigm. One shift, moving from symptom suppression to treating the root cause. And a second shift, moving from disease to health. So for the proposal for this, for physical health, is a program for physical health, which is largely for staying healthy, which would involve the intake, everything we take in, the routine, the daily lifestyle, labor and exercise, postures for regulating internal and external body organs, and regulated breathing. And then, if required, go with medication and treatment. So here you have 1, 2, and 3 as intake, routine, labor, exercise, postures, breathing. 4 is medicine and treatment. Now we can ask ourselves the question, should health education and healthcare be focusing on 1, 2, 3, and 4, or largely on 4, which seems to be happening today? If we see, when we take the body-centric approach, which you can see on the left side, we consider the human being as the body. And when we do that, we say that the brain is in charge of the body and it is responsible for all the parts of the body and their functioning. This leaves several questions unanswered. What about psychosomatic diseases? The fundamental causes of psychosomatic diseases like essential hypertension, diabetes, arthritis, cancers, so many autoimmune disorders. What is the cause for that? So here we can see that the answers are not there. So we would propose another shift in paradigm, a third shift in paradigm here, moving from a body-centric approach to a self and body approach. So in the self or mind-body approach, where of course self is more than the mind, but just for the sake of starting the process, if we look at the human being as self and body, where self is central and instructs the body through the brain, which is a part of the body, then we can understand the root cause very easily. This can address many currently unanswered questions about psychosomatic diseases. Because when we understand the self, we can address the problem at the root, in the self, and tackle the psychosomatic diseases far more efficiently. Of course, we need to have more research in the area of consciousness, but this would certainly help us deal more efficiently and adequately with mental disorders also. For example, let's take a look at stress. Today, we may be having this perspective about stress that stress is out there. Situations, activities, people tend to stress us out. So we try to manage stress by avoiding such situations, activities, and people. And sometimes we involve in other activities to try to bust this stress. People get into gardening, pottery, punching bags, and so on. But what is the reality about stress? Is stress out there or is it within us? So when a person is in harmony within, is calm and comfortable, happy within, this kind of a person doesn't interfere with the harmony of the body. So the body also continues to be in harmony. But if a person is in disharmony within, is uncomfortable, unhappy, stressed, then this leads to disharmony in the body also. As a crude example, we can see how we are when we get angry. Perhaps we may notice our hands tremble. Perhaps we may notice the heartbeat beating very uncomfortably fast. So these are all impacts of our emotion of anger, the impact on the body, leading to disharmony in the body. On the other hand, when we are in harmony within, we tend to respond to persons, activities, situations outside. But when we are in disharmony, we react to those same persons, situations, and activities. Again, I will take a gross example here. You can see when a mother beats her child, when she is comfortable within or uncomfortable within. So in a body-centric approach, where the human being is just the body, people don't really understand themselves. They don't understand the cause of many of the diseases. And when the cause of the disease is not understood, the responsibility for the health of their body is also outsourced to medical care. And again, people may not rightly utilize their body. They may be using their body just for sense gratification. But if we could have a mind-body approach where the human being can be seen to be self and body, people with this understanding will take responsibility for the health of their body and rightly utilize their body. How? We'll take a look. So here you can see in the purple is the self or the consciousness, and in the yellow is the body, the material. The need of the consciousness is for happiness and prosperity in continuity. We all want to be happy and prosperous all the time. This need of the self is fulfilled by right understanding and right feeling in the self. As a part of this right feeling in the self, what we call a healthy self, is the feeling of responsibility towards the body, the feeling for nurturing, protecting, and rightly utilizing the body. With that, the body also continues to be in health. So essentially, what is being proposed is that the self is the one that is central to the existence of a human being, And the self uses the body like its tool or like an instrument. So, shifting focus to the consciousness for keeping the body healthy rather than managing disease would be, or seemingly seems to be, a better option. Further, if we ask the question, is the human being an isolated entity, or is the human being a part of a larger whole? So, if we look at that, today we are approaching things as if human being is an isolated entity. So there is lack of clarity about the human being. There is lack of clarity about the environment in which we live. Therefore, when we don't see our relationship with others, we have broken families or broken homes. When we don't see lack of sense of relationship, when we lack the sense of relationship with other human beings, there is there is fear or uh, lack of trust in society and therefore fear in society. And when we don't see our relationship with nature, we think we are there to master and dominate over nature. So we attempt dominating over nature. All of these are going to ultimately lead to a lack of happiness, ill health, mental, and therefore physical ill health also. So a fourth shift in paradigm that is suggested is moving from seeing ourselves in isolation to understanding that we are a part of a larger whole. Now, if we look at it that way, we can see that human being is a part of a family, a member of the society, and a unit in nature. This is our environment. So, understanding the human being as self and body, understanding relationships with other human beings and with nature, people have the feeling of relationship with other human beings and the rest of nature. The outcome would be a healthy self, that is, a self in harmony or a happy self. So moving from the body-centric, isolated approach, where human being is body, where there is lack of awareness of the self, where the health of the body is dependent on getting tests done for early detection of disease, where we are medicating the body sometimes lifelong with lack of understanding of the cure or the root cause, without understanding our environment. We propose to shift to a holistic approach where we can understand the human being to be a coexistence of self and body, where the health of the self is the number one priority. And with the healthy self, the self can take care of the health of the body with a program of health, which we talked about a little bit earlier, and can also take care of the health of the environment, that is the family, society, and nature. So this is our proposed holistic approach to health. This is what we wanted to share with you today. And now we can move right into the panel discussion. Let me just ask perhaps Dr. M.K. Sharma ji. Several questions have been raised for discussion today in this vision. Do you think it is time to address the role of the self in the health and ill health of human beings on a priority basis? What are your thoughts on this, Dr. Sharma?
Okay, ma'am. Very good afternoon, all the organizer committee and all the panelists and all the participants. First of all, I want to say sorry for the yesterday internet connection. I could not use my opinion clearly. And now the question raised that first of all, I say that body is
I think we have some internet issue today also. Can I put that same question to Dr. Sudipta? Do you think it is time to address the role of the self in the health and ill health of human beings on a priority basis?
Yes, yes, yes. Very pertinent questions. The role of the self. Actually, the self is just like the central agent or the central things, the nucleus of our holistic health, and which is responsible for this, the nurturing of our body, mind, emotions, spirit, everything. So, if we are aware about it, that we are not the a part of the self, our body and mind. If in a body the proper self is not present, I mean the mind, if the proper mind, I mean the balanced mind, and that balanced mind is saying that the proper mindfulness, the practices of it, the disciplined mind, that perfectly focused mind on the particular matter, I mean the particular things, what actually we are and what we want to be. If we ask ourselves, what am I? So the practicing of this to understand what am I, it may ensure that and guiding us to think actually what I want. If in our subconscious mind, if we are thinking in this way, what we want, and that want is really which I deserve it. If the deeply thoughts on this matter, then we make clear ourselves actually what we want. The balancing thoughts, that is resilience, that is the deep thoughts, that fixing these, the different bubbles and stumbles, what we are usually facing in our mind. So the self, the realizations of self, it is the simple identity is that I myself, the name is Sudipta or like this, the everything what I have, that all are gifted from the world. This my body, this is also gifted my parents. So what am I actually? So if we think in this way, then the feeling of the proper dynamo, the yes, that the I am not the body, the apart from it. Thank you. Thank you very much.
Very nice, Dr. Sudipta. Thank you for your views. We can go back to Dr. M.K. Sharma if you are able to be connected and speak.
Yes, once more, remain sorry for internet connection problems.
No problem.
May I want to say that we are in the present scenario, self is completely depend on our emotions, and emotions is particularly the born in our excitement, and excitement is completely depend in our environment, in our relationship. So the relationship and the emotions is balancing, and a person is balancing in need and expectations, then his self is more strong than it's the influence in our body.
Nice. Thank you. Thank you for your observations. I would like to ask Teresa ji. I know that you are very much an advocate of mental health and well-being and have been doing a lot of work in this area of well-being of people. How do you feel about this addressing the role of the self in the health and ill health of human beings?
It's about time. It's really about time. So in my own life experiences, ever since I started yoga about 23 years ago, 24 years ago, well, actually more like 25 years ago, I learned that life is really about the study of the self. And this is one of the lectures that I would give in my mental and health journalism classes. Although these are aspiring journalists, one of the very important components of this course when I designed it and proposed it to the university was self-care. And the question I often put forth to my students is, what are you putting out there? Just like the two other doctors we're talking about here is, who are we? What are we? What are we putting out there today? Like if I'm sad today, then I am influencing everybody around me. But if I'm happy and I walk around like a lighthouse, I influence the people around me, the environment around me the same way. So we have that choice. And often I advocate and I speak about, what are we learning? What are we eating? What are we breathing? How are we breathing? How are we sleeping? And in the lifestyle education, all I'm getting back to is the self, the inner work, whether we are doing breath work, yoga, or Tai Chi, which I've been learning in the last 8 months, first time ever in my life. It's the same principles, whether it's Ayurveda, whether it's yoga, Sanskrit, Tai Chi, Taoism, it's all coming from with one same principle, is working on the self. So yes, it's about time. We all need to do that, is learning to work on our energy, learning to see how we could manage our emotions better. And one thing I really truly advocate as a lecturer in my classrooms for the past 10 years is that every one of students in all my courses, whether it's journalism, communication, or public speaking, or just broadcasting, they all have to do something about themselves. They all have to gather themselves. They all have to really look inside and go, how am I feeling at this moment? How am I being at this moment? And then visualize, what am I going to put out there? Even if I'm broadcasting news in the next 5 minutes, what would be my energy be like? But then they also learn how to work on the self, how to address the self. And by doing that, my role as a wellness speaker and educator is to providing them with the tools. For example, a breath work. So I have them sit down, close their eyes, stay centered, and just listen to their breathing. And over the last 10 years, every common testimonial that I get is that I feel better, I feel more relaxed, I feel more grounded, and I feel more ready to do them. Whether it's writing, whether it's broadcasting, or talking about mental health, they become more open. And this doesn't just have to happen in the classroom. This could happen inside our homes. And often my mother and I have these conversations, like, what are you working on today, Mom? She's in the US, I'm from LA. But what are you working on? And my mother and my father have groomed me to be this way, because that's all we do at home, is look at ourselves, at a conscious level, at a conscientious level. What are we putting out there? What are we providing? How are we loving the people around us? But I think the more important question in the last 20-some years for me was, again, back to the self. Who am I, Teresa? What am I working on? What do I want to grow into when I wake up the next morning, or in the next 5 years, or in the next 10 years? And this is the same questions that I walk my students and my clients through. And in conferences like this, I love this proposal. I think it's really about time. And I think this could happen in our classrooms, on campuses, is to help students understand what life is about. What are we putting out there? And what are the tools? What are the means that we could use to nurture ourselves better and grow ourselves and evolve and expand together?
Very nice, Dr. Teresa. Very nice to hear this. Coming to Dr. Meenakshi, you Ayurveda. So for you, this must seem very much in tune with whatever you have studied in the past. And how do you feel about mainstream medicine adopting this also as, putting the focus on the self? What are your thoughts on that?
Yeah. Very good afternoon to everyone. Being an Ayurvedic student, I can say that health is not just the absence of disease. It is actually, you can say, the balance of body, mind, and consciousness. According to our acharyas, they already mentioned that samadosha, samagnisha, samadhatu, malakriya, prasanna atmendriya manaha, swastha ityavi diyate. What do you mean by swasthya? This samadosha, samagni, samadhatu, malakriya, it is all about the body. But prasanna, atma, indriya, man, it is the main thing which are now lacking in the treatment also. We are just thinking about the body, not about the mind or our consciousness. But our Acharya has already mentioned that if you are focusing on this prasanna atma mana indriya, then automatically your body will get healed. So you can focus on these things. So the what do you mean by the physical well-being? That means the personalized nutrition. So the personalized nutrition, daily routine, where we can say that dinacharya and ruticharya already mentioned in Ayurveda. So we can follow these all routines. We can keep our body healthy. For your mind well-being, you can go for this yoga, meditations, all these things that will keep your mind healthy. And for the spiritual wellness, that is Atma, for spiritual wellness, you should know about the purpose of your life or self-awareness. So all these things will uh, give you the means you for your self health and for your self awareness. You can go for all these things. Thank you.
Very nice, Meenakshi ma'am. Very good to hear from you regarding this very much known thoughts in Ayurveda, but still not percolated down to mainstream medicine yet. So thank you for your views on that. Now I would like to ask Dr. Satyanarayanan about psychosomatic diseases. Do you think we really understand the root cause? Do you think we are doing much for the psychosomatic diseases? Or are we somewhat floundering in the dark with those?
Yeah, actually, to be honest, we are mostly managing the psychosomatic diseases. For example, diabetes, hypertension, some cancers, even bronchial asthma. So all these diseases, we are not curing them. We are just managing them because we don't know the root cause of the disease. These diseases, and but the modern medicine accepts that we have something beyond the body which can influence the cause of these diseases. For example, take hypertension. Stress is there in the mind, but it influences the blood pressure. So stress releases cortisol. Stress releases a hormone called as cortisol, which we all know, that will raise the blood pressure, decrease the immunity. It increases the stress. I mean, increase the activity of the other system, or whole body system will be affected. So digestion will be affected. So like that. So these origin can be found in the mind or in the self. So what I suggest is, to identify the root cause, we should take in this concept of self. Self is not a philosophical idea, but it's real. So the UHE proposal says human being is a coexistence of self and the body, and self being should be brought in the central role so that we can understand these problems of psychosomatic diseases, and even some cancers also we can understand, because some studies like American Heart Association studies and many studies says that they find out the root cause in the stress. If the stress is reduced, all the psychosomatic diseases can be tackled.
Very nice. Thank you, Dr. Satyanarayana. Being in the field, I think it takes guts to come to that conclusion that, yes, we are not doing that much for such psychosomatic diseases. And I think that brings us to that point that it's about time we made that shift, that change. Very nice. I would like to ask Dr. Kala.
Yes, madam.
How do you feel about concerns regarding the high financial burden on society, healthcare in its current form being unsustainable. What do you feel is that a genuine concern for us?
Yes, madam. India is still in the developing country only, not financially up to that much, because the self-individual economic thing is a little bit low only when we compare to the other countries. So simultaneously, the populations also seems to be increased. On the other hand, the diseases also simultaneously increased. So expenditure-wise in the medical field, so nowadays the corporate setup is going to be on one side, it's keep on increasing. So investigation, treatment, everything. Even if you go to the hospital with a little bit fever, mild fever, even it's a viral fever, we used to investigate many things. So the cost of the thing minimally at least 10 to 15,000 for a viral fever, simple viral fever. So economic wise in our country, yeah, it's a burden is high to the individual. But India is the country where we are giving the treatment for the other countries. So everyone, the medical tourism is keep on increasing in our country. I think for the Indian people, still in the developing nation, we people are suffering to have a treatment. Even a doctor, they'll be having the hesitation to go to the hospital. So because of that only, many diseases like non-communicable, even cancer or other diabetes, hypertension, the people are having the hesitation to go to the hospital, to afraid of the expenditure. So the people coming to the hospital even sometime at the end stage. So economic burden is high, definitely.
Yeah, very nice. I was reminded of when you were mentioning how even a simple viral fever can cost so much because of all the tests we do, and sometimes IV fluids we give, and hospitalization and all that intensive treatment. It was bringing to mind thoughts about things like dengue fever, for which we sometimes end up giving platelet transfusions that cost lakhs and lakhs, for which we could have done something simple at the very start. Like today, we are talking about papaya leaf juice, bringing up the platelet count, and so on. So it just brings it in very stark realization that many things where we are spending so much time and effort and finances on trying to get rid of certain things, perhaps we could be doing something different. So thank you for your views on that. If I remember correctly, when we were studying in the medical college, there was always this focus on the brain, that the brain is the most important organ in the body, and it is the one that sort of runs everything in the body and is in charge of everything in the body. But then at the same time, we also sometimes say, this is how you can train the brain. So, Kriti, I would like to ask you, do you also ever have such thoughts about, when the brain is running everything, then who is the one who is supposed to train the brain? So, what are we talking about? Do you feel also that in your studies, a very large part of the focus is on the brain?
Yes, ma'am, definitely. A lot of our course focuses on the brain, how brain impacts other organs, how we can train the brain. And I think that training comes from an higher understanding of yourself. There is a very intricate interplay between your body, yourself, brain that can lead to these psychosomatic diseases. So I think we need to explore more about that. Think in training the brain, we also need to have the right understanding of the self. We need to train the self so we can prevent the onset of all these diseases. And it is an internal thing, like we just saw in the presentation. The stress, it's not something that comes externally. It is an internal thing. I think we need to train both the self and the brain to have a better understanding towards these aspects.
Very nice. Thank you for your views, Kriti. Let me ask Dr. Panda, how do you feel about this when we are talking about psychosomatic diseases? Many things we try to explain just with the focus on the body. But do you feel that there are many things unexplained when it comes to psychosomatic diseases like diabetes, like high blood pressure, and so on? Dr. Panda, your views on this? Dr. Panda, we are not able to hear you.
Yes, ma'am. Am I audible?
Now you're audible.
Okay,
Yes.
ma'am. Thank you. Ma'am, as our topic of discussion of today, this self is a foundation of our holistic health. Because holistic health sees the person as an integrated whole, not just a body with symptoms. In this view, as you have just asked, the self can, what I can tell, self can nurture and also healthify one's own self. How? Let's discuss something about. Because no doctor or system can live inside a person's body and mind 24 into 7. The self becomes the primary guardian of health. Without active self engagement, even the best medical advice or treatment often fails to bring the lasting change. So, self awareness is the starting point of holistic health. It means recognizing one's physical signals like hunger, fullness, pain, or energy levels. What is the derangement going on inside one's body? He can only justify more better than a physician. Identify the emotions, stress, sadness, joy, and anger, the triggers, and understanding the personal values, strength, and limits in the work, may it be relationships or lifestyle. One person on that this self can justify more better than a physician. So self responsibility and empowerment also is having a very crucial role in managing the holistic health of a person. So doctor can fix me. I am responsible for my health. Holistic health shifts the mindset from the doctor will fix me. It shifts to I am the responsible for my own health. Nobody can be bothering more than me. Right. So taking the ownership of lifestyle choices like diet, exercise, and substance use, sleep, seeking reliable information and asking questions inside the blindly following advice instead of blindly following the advice. And the now coming to the self-care as an holistic practice. What are the self-care practices? May it be physical, like bodily things. For example, regular movement, balanced nutrition, adequate sleep, hygiene, and routine checkups. And as well as the mental self-care, that is the mindfulness, meditation, keeping silence for some hours in a day, learning, self-learning, setting boundaries, limiting information overload, because it can lead to our indigestion of brain. Brain is the major game player of our body. If so many, because this is the digital era, so many informations are just bounding back into the our body and brain. So as like our stomach indigestion, the brain also faces the indigestion of overloaded informations. And emotional self-care, that is the major concerns nowadays. Naming the emotions, journaling, taking this, talking to the trusted people, give having the trust upon someone. That is the main concern of today's task. Counseling when needed, practicing the compensation, because nobody is compensating anyone. Only you can compensate yourself, nobody else. Then comes to our social self-care. Nurturing supportive relationships, saying no when overwhelmed, and participating in the community day-to-day activities, spiritual and self-meaning self-care. reflecting our values, purpose, gratitude, and meditation. That is our Indian culture, ancient culture teaches us this thing. Keeping the emotional balance of one person by meditation, self-thinking, not overthinking, but self-thinking and keeping silence for some time in a day, or religious or spiritual practices that can bring our inner peace that is missing nowadays very much. Inner peace and self-balance. That means what I can say the homeostasis of our body. Homeostasis does not mean that what it is telling that by literature, maintaining of the milieu interior, not the only material or bodily things, also the mental self-care. That is for our inner peace that I am just telling now, meditation and self-thinking. And the self in the decision making and values. The self can, in our most appreciated the spiritual literature, Srimad Bhagavad Gita, Lord Krishna directly points that one point important. Buddham
Dr. Swaroop,
Atmanam Atmanam. That means you can elevate yourself, not other one. Na Atmanam Avasadayat. Don't depress yourself. Atmaiva hi Atmanaha Bandhu, Atmaiva hi Ripuratman. Means you are only your friend and you are also your enemy if your mind is not your control, under control. So a controlled mind and balanced lifestyle can bring you good health as far as I can tell. Thank you.
thank you. Thank you, Dr. Swaroop. A lot of voluminous and exhaustive explanation you were able to give about the background on the self and the significance. Thank you for that. And
Welcome.
we'll come back to you. For now, let me go back to Dr. M.K. Sharma. Do you think that we should be looking at the human being in isolation from the whole? Or do we need a shift in paradigm here also? Because the human being is a part of the family, society, nature, and existence. What are your views on this, Dr. M.K. Sharma? We are not able to hear you, sir. Okay, let me move forward. Let me come back to Dr. Kala. What is your view on this? Should we be looking at the human being in isolation from the whole, or do we need a shift in paradigm here also?
No need to shift in the isolation world, ma'am, because we are not alone in the world. We are always interconnected with someone else, like a human being, our society, environment. So our body, mind, environment, all are interconnected. So we should not consider us alone. We should always have an interconnection with human being, even by neighbors, our family members, everything. If we are interconnected with others, definitely we can avoid many problems in the world, especially mind-related problems, the depression, psychotic disorders, and even body diseases also we can remove if we don't feel we are alone. So ourself is always interconnected with other one. Otherwise, if you feel alone, definitely we cannot live in the world. That's very much difficult. So always you have interconnection. It's not alone.
Yes.
It's surrounded by our five Panchapudas always. So without having the connection with the Panchapudas, definitely we cannot live.
Yeah, very true. We may assume many things, but the truth may be something quite different. Very rightly said. Coming to Ms. Teresa again, how do you feel about this? That can we see the human being in isolation, or do we have to consider all of this when we think of health? Should we be considering family, society, nature, all of this when we talk of health?
I think we're covering so much ground here, like this could take days. But back to the number one question, how you started this panel discussion is everything begins with the self. So I'm a huge proponent of working on the self. And it takes a lot of time, it takes a lot of awareness, but we are definitely an integral part of our families, of the larger community, and of the global village. So we cannot isolate ourselves. But I do believe, as in my own experience and in many of you, and all the practical tips that you have shared, I think every individual needs to spend time working on themselves, consciously making time for it. And I think one of the big stumbling blocks, the big hurdles is people always say, well, I'm so busy. I'm busy taking care of my kid. I'm busy looking after everybody else. I'm busy, busy, busy. Well, then my big question that I always raise to people is, if you have time to take care of everybody else, how come you have no time for you? Out of 24 hours, like you couldn't take 5 minutes to do a breath work exercise. You couldn't take 10 minutes to do some yoga stretches. It's not possible. So I think, yes, everybody from beginning as a kid to adults to, elderly people, we all need to work on ourselves, because we are all part of the larger society, and what we put out there or what we put inside and then we let out there would affect everybody. And you guys talk about prevention and the root causes and all that, and stress. And I think it all comes back to self-reflection. What are the root causes? And one of the things that I help my students understand is, what is causing your stress internally? I'm getting ready for a 21-day solitude, like 21 days of solitude, because I'm really aware that over the past few years, it's been very stressful. Having to go through grief, death in the family, like very high tension times, the pandemic. But how many of us are actually having this awareness, understanding our body is giving us signals? My back is no longer straight, or, I'm doing this instead of doing this, my composure changes. I think these are the things that we need to look into, and watch the people around you. How is their face changing? How's hair changing? How is their smile lines changing? How are their body gestures changing? How are they breathing differently? How are they eating differently? I think these are the cues. But the biggest problem in society is everyone forges forward. They force forward because they refuse to take time to take a pause.
True.
And I advocate this, and I would advertise on my social media. Look, I'm taking a 21-day solitude, all time to myself, because I cancel a conference to Malaysia. I'm doing this today, last working related stuff. And then I think that's really important. And people, whether you have a family, you're single, whatever, you need to make time for yourself. Because again, from what I said earlier, and everyone's been saying the same thing, the common theme is, when we could take care of ourselves, we could do prevention, we could benefit society, and we could lower the cost of healthcare, which is becoming increasingly expensive everywhere. In the US, if you don't have health insurance, you're doomed. In Hong Kong, the same way. We have very good hospital systems here, very good healthcare, but I think everyone should take the responsibility, where knowing and understanding that the better society starts with the me, with the self.
Very true. Very rightly said. And I think the whole understanding within the self, as it grows, then we can understand how to take care of not only ourselves, the body, but others also. Very nicely said, Ms. Teresa. Thank you for your views on that. Minakshi ji, if I may ask you, you are very familiar with this, seeing that the human being is not in isolation. And I think many of the Ayurvedic principles, you are able to relate to that very naturally. How do you feel that if we could bring this into modern medicine, can you see a change happening in the way we look at health today?
The first thing is that the human being, mostly we like the social life. So isolation, we already experienced everyone in the COVID-19 period. So that is the disaster for everyone, because the most people are that time we increase this psychological problems more in even youth, kids, and even the elder peoples also. Even in nuclear family and joint family, if you compare, the nuclear families are having more psychological problems than this joint family. Now the women are having more psychological problems. Before, in joint family, they can gossip with each other, and their stress level will reduce due to this gossiping and all these things. But now the nuclear families, there is nobody is there to listen what they feel. So this isolation is not for us, at least. So in medical, if you are thinking about the medicinal part, even the isolation therapy is also not good. We can go for the combination of the therapies, like the conventional treatment with the complementary treatment. Even the study shows that we can reduce 4% cost of hospital cost by doing this combination therapy also. We can reduce the cost giving the herbal medicine with the conventional therapies. If you can go for the cancer treatment also, if you are giving the chemotherapy, radiotherapy along with the herbal medicines, then we can increase the quality of life of the patient, not the quantity of life, but at least quality of life we can increase the patient. So if the combination of therapy we are giving, then also it will give the satisfaction to the patient also. He will feel, I'm getting two treatments, and definitely I will be cured with this treatment. If you can see the patient view, because he likes to take allopathic medicines also and Ayurvedic medicines also. He like to take that churna kada also with the these injections also. So satisfaction is more important. If he is satisfied, if psychologically if he is satisfied, automatically he will get rid of his disease. The body will get healed very fast. So this is my view on this. Thank you.
Thank you. Thank you, Dr. Minakshi. You raised that very important point of how the mental satisfaction plays such an important role in the healing of the body. Thank you. I would ask Dr. Satyanarayanan the same question regarding this, rather than seeing in isolation,
Yeah.
do you think a holistic perspective would be important to take?
Yeah,
in this?
definitely, because we see things isolatedly, nothing will work. There's a popular study from Harvard University. There's a 75-year-old study done from 1938. So they observed two parallel groups for 75 years. The result of that study was some shocking truths. The cause for happiness is not from money or fame or whatever it is. The relationships, good relationships, people with good relationships, they were very happy and they prolonged their life. So, holistic perspective is very important. And as UHG proposal says, human being is the coexistence of self and the body. So we have to consider self in the holistic perspective. And one more proposal is, we should consider family, society, and nature all together as a holistic way. So if they all are connected, as Dr. Kala told, so interconnectedness gives life a meaning. And in fact, it will give rise to compassion, which is a natural outcome of living in relationships. So that compassion will be a natural outcome of this, which might give happiness to everyone. So the whole society will become, they trust each other. It will become mutual happiness will be there and mutual prosperity will be there. So that the holistic perspective is the need of the hour, and it's time to start, because such youngsters, future youngsters, their future healthcare depending upon this holistic approach only. Because we see, the current system is falling. You can see the US, the 18% of their GDP is spent for healthcare. That doesn't work now. And even WHO estimates 100,000, 100 million people are going towards poverty line, extreme poverty because of healthcare costs. So all these statistics suggest that we should have a paradigm shift. As the presentation he told, the paradigm shifts from symptom to root cause, from all the four shifts, which are very vital in bringing out a change. And that is the future of healthcare. Now, current system is unsustainable because of so many reasons which we identified. Chronic disease are worsening more and more. and lifelong treatment is required. So all these all these problems, only solution is we should bring up the holistic perspective, which we should bring in the self as well as the family, society, and nature existence all together. So all this consideration will lead to future healthcare, will give rise to good healthcare in future. That's my vision. Thank you.
Very nice, Dr. Satyanarayanan. I know that you are also very much into holistic health, and we can definitely see many benefits of this. If I may ask Dr. M.K. Sharma the same question about, do you think that a holistic perspective would help to uh, change things around in the health system today?
Yes, yes, ma'am. I completely agree. This holistic approach is a must compulsory in the present scenario. Not only diverse field, education, medical, engineering, or and other etc. Because in the present scenario, not a single person survive in classroom, family, society, and overall, so many years ago, Aristotle say man is not a singular human being. That overall we consider all part the society, family, classrooms. Then we survive and establish in our vision holistic perspective is must necessary and compulsory in medical system, so is necessary for it. It's my view.
Yeah, very nice, Dr. M.K. Sharma. It's very true that once we bring it into education, once it becomes mainstream, then we won't have to struggle so much. But today, because it is not mainstream, we have to sit and talk about this. So thank you for your views on that. I would like to ask Kriti, how do you feel about, when we are talking about holistic perspective, from whatever you have been through the medical college till now, how much do you think focus is on holistic, being holistic, or the mind, impact on the body? Have you noticed that so far in your studies?
Ma'am, the current scenario, if we see, I don't think there is much focus on the holistic healthcare. Even for diseases, psychosomatic diseases, we hear the word idiopathic because there is not much exploration about it. We have to explore more about it so we can provide better solutions. But at the same time, I think there is a gradual shift because we have started including preventative medicine. We have started talking about preventions along with the cause and the symptoms and everything. So that is a small step that we have taken, and I think we have to build more on that, because when we talk about health, like the WHO definition itself says that it encompasses physical, mental, spiritual well-being as well. So if we only treat the physical body in isolation, that is not true healthcare. So we need to take bigger steps towards it, but we are getting there.
Very nice. I like Kriti's attitude, always positive, always moving forward, no looking back. That's the way to go. Um, Thank you for your views. Let me ask now, Dr. Ghoshal, how do you feel regarding a holistic perspective? Do you think that that would be helpful in solving some of our problems in health today? Dr. Ghoshal?
Yes. Am I audible now?
Yes, you're audible.
Okay, okay. Yeah, the holistic perspective is always the immense value for maintaining the health, as because the body, mind, the spiritual the emotional, social, everything, they are the determinant for maintaining a positive health. That's why the holistic health is thinking we are right now much more emphasis and pertinent for this. That is our diet, that is our cognitive development. The nowadays the CBT is there, the cognitive behavioral therapy is also needed for corrections of all the problems. We people are not think from the very childhood age that it is needed in our society, and the family is not properly build up the atmosphere to make a proper guidelines for the children. We are engaging them in a big school, but actually the mind is not properly fed. We can buy the good bed, but we can buy the sleep. This is we should think in this way. The growth of the middle class people, there is an immense growth due to the income level, the GDP is high. But in one side, the economic growth is there, and the another side, the non-communicable disease is tremendously growing. We are continuously engaging in the different social media, and at night, at least the minimum 8 years of sleeping is essential. The minimum 8 to 10 hours of sleeping is essential. But the people, we are engaging in the different social media activities. So consequences of this, that nowadays, even the blood sugar, the hypertension, the young, they are the more prone to the attack. So ultimately, these are all we must think. And the meditation, if we can think that in our good body, the good mind should be there. Just I want to the another incident, the listening the good song, I mean the classical song, it can help our memory, it can help the balancing the situations, and we must realize that in our body a good mind should there, and for maintaining a good mind engineering, in nowadays the all over the world the different engineering is there, but there is an absence of the mind engineering, and that is the most essential. Thank you very much. Namaste.
Thank you, Dr. Sudipta. Just you're mentioning that the GDP is increasing, but communicable diseases are increasing too, non-communicable diseases. So on the lighter side, you can see that the non-communicable diseases are adding to the increase in GDP also, unfortunately. Yeah.
That is also true. The
Yeah.
last day's questions, we are focusing on the healthcare, not I mean the disease, not the health. That is the very much pertinent and relations with this. Absolutely right.
Yeah, thank you. Thank you. Very discussion was just warming up, and lot many insights from various streams. It is so good that we have different streams of people here with us, and we can see the need and the vision of holistic approach, how it could help transform how we look at healthcare or medicine today. But moving forward, I would ask Amipara ji if he would like to share. There were some polls on the screen, if he would like to share the results, and also to see if our delegates have some questions so that we can interact with them also a little bit. Dr. Amipara?
Yeah. Our delegates are participating enthusiastically, and outcome of the poll regarding the question of root cause clarity about psychosomatic issues. 86 people are strongly agree, and 14% of the people are agreeing. And there was another poll about the understanding the self and its role for the better health. 74% of the people are strongly agree with the panelist, and 26 people are agree with the panelist. And about the inclusion of the environment, that is family, society, and nature, the 85% of the people are strongly agree, and 15% people are agreeing with the panelist. As far as questions are concerned, there was a question for Saguna Dampala. According to her, the insurance part, Aishman Bharat, takes care of up to 5 lakhs. This is regarding the probably economic part. If she would like to say anything further, she can raise the hand.
I think it was just an observation in the chat, or was there a question also?
That was her opinion that up to 5 lakhs people are Aishman Bharat is people are getting the benefits of the health.
Yeah.
If any question about that, then probably she can ask.
Yes. So I think we can see very much that when you outsource things to a third party, the third party is also in it for the business and the profit. So ultimately, insurance is taking care of itself also. And while we may get the help in certain medical conditions, but ultimately we end up also paying for whatever care we receive from there. So if you have further questions on it, please do raise your hand. Or if you would like to ask any of our panelists anything in particular, if you raise your hands, then we can pass the mic to you. Are there any hands raised, Amiparaji?
Yeah, I think this Suguna Dimpala has raised hand. Mic is passed to her.
Yes, please unmute and you can put your question forward. Sugnaji? Okay, we can go to the next raised hand.
Yeah, next raised hand is Prabjot Kaur Gill. Mic is passed to her.
Hello, good afternoon, everyone, panelists. Myself, Dr. Prabjot, I am Professor Biomedical Research in the Shri Guru Ramdas University of Health Sciences, Shri Amritsar. Actually, ma'am, I am taking this subject, human value to ethics, to all the MBBS first year students. And just I have taken one of my class today. And as I'm dealing with the students, they are very adamant that we are taking up the skill training, and it's very difficult to cope up with this universal human value and ethics, because they are taking the classes from 8 to 3:30 p.m. and they are always said that we are always busy. And when I am teaching this human value, they are just concentrating more on their assignments and all that. And what I have tried, when just your desire is happiness and prosperity, they are not showing any interest. They are just laughing when why you are teaching to this subject. And but I am reaching to the area of that human being is the coexistence of self and body, then I am actually teaching that how the physical facility related to the body and what are the need of the self, how they can identify the need of the self, then they show little bit interest. that self is there, and we have to identify the need of the self. But still, I'm not very much sure whether they are built up with this human value ethics or not. We are actually trying our best, but if any type of help is there, actually, we are collaborating with the Amritsar group of colleges, and Dr. Rajneesh are helping us for that. But still, if anybody can help, how we can more emphasizing that student can learn this and get this more about the human value and ethics.
Yeah, I can suggest a few pointers. What we have found is that when you put things forward in the form of a proposal, just not to try to convince the students about it, but just put it as a proposal which they can verify for themselves with their own inner voice or the natural acceptance, then there is a lot more acceptance to it. That is one thing. The other thing is that as the facilitators for these courses, the more we introspect within us, the more we start understanding, and it shows in our behavior, the more the students get motivated. And as you rightly said, the more the connectivity happens when they see the relatedness with the topic, then they start taking more interest. So when you said about
Yes, ma'am.
the self and the body, now when they
Yes.
can see the relatedness that you do exist besides what is visible to you in the mirror, then they can probably relate to it. And especially what we found that when we talk of relationships in the workshops, that's when the people really connect, because that's a sore point for most families, because there are lots of unfulfilled relationships. So when we discuss about those, then there are a lot many more people who are able to relate to it. So I would say be patient and continue your good work. I'm sure it
Yes.
will
Thank
bring
you, ma'am.
rewards. All the best.
Sure, ma'am. Thank you so much. Thank
All
you
the
so
best,
much.
Prabhjyoti. Thank you.
We have Dr. Porshak Patel with us. If we can pass
Yes.
on the mic.
Can I say something in addition to that?
Yes, please.
Yeah, because this, I think it really directly relates to what I've been doing in the last 10 years with my students is, I think, one, being an inspiration, and two, having the students together, co-creating the human experience. And I think what we're lacking of all the things that we've been discussing today is people, one, having the awareness to do the inner work, and two, having the ability or the tools to feel. So what it feels like to not overthink. What does it feel like to not have stress? What does it feel like to actually close your eyes and just breathe and do nothing? And so I do this with my students, and then I have them come out and say, would you like to share how you feel? And everyone would have a different word, right? And then, every week I would tell them, go home and reflect. You don't have to share everything with me, but at least have the awareness that you are actually going through an experience of actually knowing what it feels like to stay quiet, what it feels like to feel grounded, what it feels like to relax, what it feels like to not have the monkey mind. And I show them images of the monkey mind and the positive mind with all the positive images, beautiful flowers and butterflies, right? And then the monkey mind with all the anxiety and all the craziness in the head. And then I go, which one do you want? And obviously, most people choose the positive mind. So I think co-creating that experience and having them walk them through the path of self-awareness and having them do the work at home. And then when they're happy with it, they could share it. And at the end of the semester, I have them write a reflection paper, and I emphasize, remember, this is not about me, your lecturer. This is not about writing to me to please me. This is about you reflecting what you've been doing with self-care, with looking inward the entire semester for 13 weeks. And the results are amazing, because at least then I know I've guided them to And I find this very powerful. If we could do this as teachers in our own classrooms on a day-to-day basis or weekly basis, however often you meet your students, I find it very empowering.
Very nice. Thank you for that tip. I'm sure that will be useful to our delegates.
I hope so.
Yeah, thank you. Amiparaji, any more questions or any more raised hands?
One more question from BPS Bedi, Coordinator India.
Yes.
In the USA, major surgeries are not allowed, but in India, there is no check, especially for heart, spine, and brain. Don't you think that doctors are also responsible for expensive treatment? This is the question.
Yeah. So very true. A lot of times, many surgeries and many other invasive procedures may be done, which may be actually leading to more of a problem with the financial crisis in the medical field. But having said that, we need to also understand that why this is happening. So a lot of times there is this need for profit maximization that people feel, and doctors are no exception. Just like other human beings who lack understanding, who are not able to see the harmony within themselves, are searching for happiness outside, and sometimes they look at it as more financial stability or more um, physical things, and that may be a cause. So ultimately, I would say it is a lack of understanding wherever we see, and whoever may be responsible. Ultimately, understanding is the need for doctors, for non-doctors, for people of all fields, all ages. And I think with that awareness and with the growing understanding which we can provide, we may be able to see a shift. So this is how I would respond to that question. Yes, Amiparaji, we have a couple more minutes. We can take some other.
There is no more questions.
Okay. So very nice. I think Sugna ji, we are not able to hear. The raised hand was there, but the mic is also there, but we are not able to hear.
Mic is passed on to you. If you are able to respond, please respond.
Okay, I think maybe not. So I would just like to take this opportunity to thank all our esteemed panelists who are here. And we had a very good discussion today. Many of us are in diverse areas of the medical field or in well-being and holistic work. So it was great to have you on our panel. It was great to interact with all of you. And so today we discussed the vision on holistic health. And tomorrow we want to talk a little bit about the implementation of this vision for holistic health. So we have been implementing it in a way in which it can be meaningful for institutions, for people, for the educational field. So we'll share that with you and get your thoughts on that, and also what you may be doing in the field of implementing such holistic views. So we will look forward to your participation tomorrow also with all of us. Do join in. And I would like to also thank all the delegates for all their participation, the questions, the interaction that you put forward. And I urge the delegates also to join us tomorrow at the same time. No, not at the same time. I'm sorry. Tomorrow's session will be earlier, 9:45 in the morning India time. So please join us, and we'll have more discussion on how to implement this vision for holistic health and how you, if you are interested in it, how you can take this to your institution, how you can do workshops. We'll talk more in depth about all of that. Thank you, everyone, and good day to